Well, good evening, you brave and resilient souls. So I actually have more questions than anything else. Let me just say that I think anyone who designs anything actually shows up with preconceptions. And what is a threat, for example? What is something we welcome? What people are threats? And what people do we welcome? I'm engaged in a discussion with the Hall of Science in Queens, in Corona. It's in what was the World's Fair at one time, near the Queens Museum. And the Hall of Science is it's like a museum for kids. And the neighborhood is mainly Latino now, immigrant, a lot of Ecuadorians, but it used to be Italian and Jewish. And the board of the Hall of Science still pretty much reflects what it was like long ago in terms of who's on the board. And the kids who live in the neighborhood now, they tend to be low income. Their folks don't make a lot of money. And if you were a kid in the neighborhood, you would get the feeling that you're not welcome at the museum. For one thing, there's not free admission for school children. And so you need to pay a significant amount of money for them to even enter it. And once you're in there, there are all these things for kids, but it's not all kids that are welcome in that place. So we're involved in conversations. We want to build a preschool there and an elementary school, and we want to link the school to the Hall of Science so the kids can have an enriched environmental education, introduction to STEM, and things like that. And the kinds of conversations we're having are around things like, well, is it safe if we have a whole lot of those people kind of around? And what security measures are going to be in place? I kind of see having a museum focused on the environment and on STEM with a community that was displaced from the Ecuadorian Amazon is kind of fortuitous. Because here you have people and kids who can actually study their family history and their journey here and connect it to what's going on where their ancestors were, where their relatives still are. And they are, to me, it's pretty cool. And also, if we're able to inspire kids there and get them on a path to become environmental scientists of one sort or another, they can go back there. And Queens is now the most diverse place in the entire earth in terms of ethnicities, languages, backgrounds. What if Queens became the place that was training environmentalists who go all over the world? And what if the Hall of Science was an incubator for that? For me, that's exciting. For others, for some folks, that is really not imaginable because the people who live around the Hall of Science now are threatening, are scary, not folks we want to embrace. So another kind of threat that I guess you heard earlier from our resilience team, Janie Bavishi, I believe. One of the issues we face in New York City, how to think about rising sea levels. We have 520 miles of coastline, more than all the West Coast cities and Miami, Norfolk combined. We have that much coastline in New York. So one way of thinking about rising sea levels is water is a threat. We need to protect ourselves from water. Can we build a wall 520 miles around? And I appreciated the presentation right before mine. Should we build a wall? Does that make sense? Oh, how much will that cost? Because the water is a threat. Another way of thinking about the water is actually the water is welcome. And maybe we should be thinking about Manhattan as another Venice. Maybe we should think about water and turbines and water making renewable energy. Maybe we should think about water as something that can help beautify the city. But these preconceptions about what is a threat, what is welcome, I think we have to interrogate. Because design takes off in one direction or another direction to a great degree, depending on where you're coming from, where you're starting from, what your preconceptions are, and how good are we at interrogating our preconceptions, and where do we learn those kinds of skills. Another thing I just wanted to introduce, in the spirit of not being a designer, but wanting to provoke designers, Donald Trump. A lot of people are focused on Donald Trump, the personality. And is Donald Trump mentally ill or not? That's the recent conversation on TV. Has he lost it or not? But to me, what is more worrisome than Donald Trump are the 35–40% of Americans who are still 100% in Donald Trump's corner. Or the fact that we elected Donald Trump in the first place, and technicalities of the Electoral College aside. Because I think we have to ask ourselves, what is it about our society, after having been a democracy for 250-odd years, roughly, how is it we elect someone and we're worried about someone being reelected who actually doesn't care about democracy? How is such a person popular in a country that claims to be the oldest democracy in the world? What is it about our institutions, our day-to-day life, our way of life, that makes democracy such a fragile thing right now, to this day? That is something I think we need to interrogate, all of us, really deeply. And from the standpoint of design, I've always been struck by America is thoroughly segregated racially. And this was done consciously. And I've yet to see a book by a designer on segregation by design. And what are the implications of that on human society? And what does it mean to design for a democracy, as opposed to living in a society that is segregated by design? To me, that's a profound theoretical question for design. And I've yet to see a single book interrogating that question. But I think it affects our day-to-day life in America profoundly. I don't think you can understand how we have a Donald Trump, how we have such warring camps in American society, unless we understand what segregation did by design and its impact on day-to-day lives and how people form their identities and how people form concepts of who's a threat and who's welcome, who belongs, who doesn't belong. And before you have public spaces or people even wanting to have public spaces, you have to have people who actually want to interact with other people. And where do those ideas and feelings and sentiments come from? And how does our design of day-to-day life and day-to-day interactions affect that kind of awareness? So to me, that's a question. And by the way, why do we limit design to physical spaces? Our economy is also a design. And what is the impact of that kind of design on everything else that happens in society? So those are some of the questions I have. I have a couple bones to pick also. One bone I have to pick, I was told this session was about the built environment. So one of the bones I have to pick is this notion that I'll be honest, I get upset with terms like wilderness. You know, there's the World Wilderness Federation, and we have to save the animals, and because, you know, human activity is encroaching on the animals and, you know, the trees and the wilderness. And I'm a big outdoorsman, so it's not that I don't like animals and I don't like being in the woods and all that. I really do. But I think the notion that there was an untrammeled natural wilderness, and when Christopher Columbus so-called discovered America, you know, there was just a wilderness here. You know, it was a pure wilderness, and then we have to protect the wilderness, and we have to protect, you know, what's left of the wilderness or the natural world, and we should all be focused on that. I just think that's mythology. It's myth. Even when Columbus got here, the so-called wilderness had been affected by thousands and tens of thousands of years of human activity. You know, they had burn-offs of wooded areas, you know, and various things for thousands of years. It may have appeared to Columbus to be untrammeled, but I don't even think it appeared that way. There were 30 million indigenous people in the Americas when Columbus got here. This wasn't an unsettled, pure kind of wilderness. And I say that to say human activity has affected the landscape, has affected every part of this earth for millennia. And saying that doesn't mean we don't care about trees and wildlife. I think it means we have to be especially aware of how human activities, human endeavors, interact with trees, wildlife, and the environment more generally. So I'm not saying this to say we should be less concerned about birds and trees and other things. I think we should actually understand that we have always been interacting with those things, and we need to be much more aware or conscious of how we interact with those things. And the built environment really is the entire Earth when we're talking about the built environment. And the bone I want to pick is the built environment is not just about some high-rise buildings or a paved street. It's about all of our activity, and its impact is on everything in the world, including the oceans, everything. If you start from that perspective, that the whole world is built or constructed or human impacted, and if you acknowledge that human beings are physical beings embedded in this environment, it follows that we ought to pay attention to how all of our activities shape the environment as well as shape human beings, including human health. But human beings, social interactions, human health as well. Now, on the health front, it's a really hard battle. And I can say that we have a program in New York called Thrive. And when I go around the city from community to community, people ask for Thrive constantly. And Thrive is a mental health initiative, community-oriented mental health, where people taking away the stigma and providing resources, places for people to go to talk about their problems, you know, when they have mental health problems. This thing is highly popular. People ask for it everywhere. In schools, they ask for social emotional learning. People want this because they feel they need it. However, if you go to the State Department of Health or the Federal Department of Health saying, look, we're doing all these mental health, you know, programs, they're not reimbursable by Medicaid or Medicare, because health is really dominated by microbiologists. And if you can't show that one intervention is what prevents a suicide, if you can't show it's that you give this pill and then there's a cure, then the argument is we can't show that this helps anything, so therefore we won't pay for it. Which means now that the city's been spending almost $1 billion a year to fund this initiative, and even though you ask people, is this helping? People say yes, but we can't measure it the way we measure treating a strep throat. And so it's not fundable. And when this mayor leaves, I don't know if another mayor will spend $1 billion a year or more addressing this mental health need, even though it's chronic. It's an epidemic. It's hugely needed, hugely demanded. And guess what? Our physical environment is producing this demand and need for mental health interventions, is producing stress, affecting communities all across this city. So I'm saying this way of thinking about the interconnectedness of things, multivariate causality, is a very difficult battle when it comes to government. And I can't say it's a battle we're winning. And I actually think social science needs to do a better job at dealing with complex social causation, complex environmental kinds of causation, and not try and mimic natural science, like we can reduce human beings and the social environment, like we're talking about cellular biology, because it's not the same thing. But one kind of approach has legitimacy, and the social approach does not. I just want to mention that I have been working for about 7 years in Central Brooklyn with a bunch of community groups and hospitals and unions that have embraced this kind of approach that in order to improve community health, we have to deal with housing, we have to deal with food deserts, we have to deal with lack of safe and attractive and appealing open spaces and recreational spaces, and we have to deal with poverty's effect on health. And every summer for the last 4 years, students from high school, college, and some grad students from Pratt and MIT have done about 1,000 in-depth surveys a summer with residents in Central Brooklyn, asking them how they feel about these issues and what they think ought to be done. And it's actually created a lot of momentum in the community that we address these issues holistically. And then Queens now wants to follow that example. The program in Brooklyn is now called Vital Brooklyn, but the governor was about to close down Interfaith Hospital. The community rallied because we have been working on these issues, and not only did he not close down Interfaith, he gave the community 2 more hospitals, Brookdale and Wyckoff, and that's now a system called One Brooklyn. And they are all working to change the physical environment, but also to change the social environment and the food systems, and work on their procurement streams to use the dollars where they buy goods and supplies to help create jobs in the neighborhood, et cetera. And to me, that's really promising and the way forward. But when we get to higher government and talk about reimbursement, we run into problems. So this is a battle that we're going to have to wage. The last thing I want to say is that one of the things I've come to see more and more clearly is that if we dealt with the problems of poverty, lack of education, bad housing, poor nutrition, lack of preventative medicine in the first place, segregation, we would actually save money at the end of the day. Poverty is really expensive to maintain. Bad education is actually more expensive than good education at the end of the day. We pay for the bad things we do, literally. But I think we have to ask, how is it and why is it that we have defined efficiency and fiscal discipline in opposition to the notion of caring for people, in opposition to the notion of a community of belonging? Why are those things counterposed? And if you mainstream economics say these things are, you can have one or the other, but they're opposites. But how did that come to be? I think this way of thinking is a legacy of our nation's beginning in a system of slavery. But it's a false opposition. And social inclusion and equity actually is also good economics. It's actually good design. And I think this is the case that we're challenged to make. And we can prove it through our work, starting one place then another place, then another place. And, that's what we're trying to do here in this city. I will give one last example. Under the Giuliani administration, Giuliani said he doesn't care about causes of crime. The cause of crime are criminals. And we should just lock people up. That's basically pretty much a quote. And then under Bloomberg, we stopped and frisked 6 million young people. Over 90% of them were Black and Latino males. And the idea was this was making us safe. Well, this last year was the lowest murder rate since 1942. And we arrested 100,000 fewer people. And stop and frisk was reduced by over 90%. And our prisons have less than 7,000 now. When I worked for Dave Dinkins, we had over 22,000. So we've dramatically reduced our prison population. We've dramatically reduced arrests. We've dramatically reduced our stopping and frisking. And then crime is at a historic low, one of the lowest in the entire world for a city of this size. And this was supposedly impossible, right? Because jail was supposed to be the remedy for crime. And it's just one of those myths. So I think in order for us to really succeed in this mission, we just have to take down some myths and be courageous and sort of showing the world what we can do when we act on our best instincts, when we interrogate our motives really deeply, and become our best selves. So thank you very much.